Care Hospital, Banjara Hills. Now, we have partnered to start what is called as a bronchoscopy suite. Now, what's a bronchoscopy suite? Basically, it can be done in any room bronchoscopy, that's not a problem. But we have designed and put all the instruments which are required for diagnostic and therapeutic work in the same place. You have a suite where you have a regular operation theater, then you have a regular anesthesia apparatus, then we have the facility for doing rigid bronchoscopy, then we can do flexible bronchoscopy, and we have all the instruments which are required for doing a interventional work under one roof. We have fluoroscopy on call, we have laser, we have APC, we have cryo, we have electrocautery. You name it, we have it under the same roof at one place. What's the advantage? The advantage is you don't have to give up halfway through and say that no, this person requires a rigid bronchoscopy, so you come back after a couple of days or something. In case it is required, it is a smooth, seamless transition from a diagnostic study to a full-fledged therapeutic procedure, all within the same sitting, so that multiple anesthesia things are prevented. You do not have to wait for a couple of days, and the entire process can be done in a very streamlined manner. And Care Hospital per se has been very, very proactive in trying to put up an excellent set of instruments for this bronchoscopy suite. We have one of the best flexible bronchoscopy systems which are available right now with a 4K definition, which I'm sure nobody else in the city has got that. We've got the latest of the EBUS, which is endobronchial ultrasound, to do the mediastinal sampling. Then we have the flexi-rigid bronchoscope, thoracoscope for doing any pleural work. We also have got the rigid for any pleural-based therapeutic work which is required. And bronchoscopes wise, we have different sizes. We have a 6 mm, we have a 4 mm, we have a 2.5 mm, we have a regular convex probe EBUS, we have a radial probe. We have just about everything under the sun required for interventional work. Now, having all these things under one roof, I take pride in saying that, yeah, this is wonderful to work under in such an environment which is so conducive for doing interventional pulmonology work. And I'm sure as and when required, Care Banjara is going to scale up on the equipment that is required, any future developments which are there. I'm sure they're going to be there and be very, very supportive here. We have an excellent team here so that we can, right from pediatric to geriatric, we can do diagnostic, we can do therapeutic. There's nothing that we just can't do. Rigid bronchoscopy system, we have been doing pediatric in this hospital also. We have already started all this process. But to do it all under one roof, otherwise you go to the theater, otherwise you go somewhere else and do that, all that is gone now. This is one-stop center for diagnostic and therapeutic work in interventional pulmonology. I'm sure if any of you are interested, please do drop in and I'll be more than happy to show you what kind of a setup you have. And I'm sure Care is quite proud of it. I'm definitely proud of what we have here. Thank you.